my name is Brittnie Smithley. I am an athletic training student at Texas Lutheran University, and today I'll be demonstrating how to do Maitland mobilizations. So Maitland mobilizations are used to decrease pain and increase range of motion, depending on what grade you're using, and there are 4 different grades. The first 2 are kind of small grade oscillations within the range of motion that the joint already has, and these are kind of used to decrease pain and break pain spasm cycles. Grades 3 and 4 are oscillations where you are taken either to the joint's limited range of motion or through the joint's range of motion, and this is used to help increase the movement of those accessory motions and stretch the joint capsule a little bit. The kind of theory behind this is that the joint mobilizations are helping with the synovial fluid circulation within the joint itself and kind of giving some of that proprioceptive feedback. And like I said, it's assisting with the accessory motion and kind of stretching of that joint capsule to help increase range of motion. So to perform these, you want the patient to relax and have the joint in its open, packed position. And this is going to be different at each joint of the body, but for the sake of time today, I'm only going to be showing y'all on the shoulder. If you aren't familiar with what an open, packed position means, it's just whatever joint position allows the most space between the 2 articular surfaces of the bones. So I have my patient here today, and I'm going to ask her to lay supine on the table with her shoulders slightly hanging off so that she's in a relaxed open pack position at the joint. So go ahead and lay on your back. And I'm just going to have her arm in kind of the socket of my waist so she can be relaxed. And then today I'll be describing an anterior move of the shoulder. So what we're going to do is we're going to have her arm resting in my left hand, and with my right hand I'm going to kind of grab hold of the humeral head. And we'll start with a grade 1 oscillation. For a grade 1 oscillation, you want her to be in that open pack position, nice and relaxed, and you just want to do gentle oscillations at the shoulder. And you're going to want to do this about 1 to 2 times a second for anywhere from 1 to 5 minutes. So just kind of going like this. For grade 2 oscillations, they can be a little bit bigger. But all in all, they're still kind of within the range of motion she has at the joint. Then when we get into grade 3, we'll take her all the way out to that anterior range of motion, kind of stretching the joint capsule a little bit. And then grade 4 mobilizations, we're going to come to the end range of motion, and then we're going to oscillate at that end range of motion to kind of stretch the joint capsule. Like I said, these oscillations, especially grade 1 and 2, are going to help if she has any pain within her shoulder joint. They're going to kind of break that pain spasm cycle as well. And when we get into the grade 3 and 4 mobilizations, that's going to be where we're stretching that anterior joint capsule and kind of helping with any accessory motions that she might have at the shoulder. And that is how you perform Maitland mobilization.
Hi, my name is Ruth, Acuna, and today I'll be demonstrating a P&F stretching technique, the contract to relax for the hamstring. The goal for this stretch is just basically to help with to increase flexibility within the hamstrings. So we're just gonna have her lie down supine, and we're gonna just lift up the leg, as so. And you want to have your hand right here on the heel, so that way you can have some control over. And we'll just hold it up here for about 10 seconds. And then we're going to have her contract the leg, and then just have her push down all the way. And then we're just going to passively bring up the leg again. And you want to do this about 3 to 5 times just to get it in there. So we'll just hold it 10 more seconds, and then contract, and then push down, and then we're going to relax and bring it back up. And then contract, and relax, and then one more time. Contract, and then relax, and back up. And that's basically just how you do it. And just bring it back down.
Hi, my name is Alexandria Douglas, and I'll be showing you a mulligan with movement technique with a fibular glide. The idea is that it'll decrease pain with movement by giving proprioceptive and sensory feedback to the brain with non-threatening signals. I'm going to have my patient here sit in a genuflex position with her injured ankle forward. Okay, good.
Yes.
And I'm going to begin by putting just a slight pressure on the head of her malleolus and just pushing back a little bit while she leans forward towards me. And we'll repeat this about 6 times. And I'll follow up by asking her if she feels any better, if she does it by herself.
Yes.
And then if the patient's able to progress, they'll continue with 3 sets of 10.
Hi, my name is Brittnie Smithley. I'm an athletic training student here at Texas Lutheran University, and today I'll be showing you how to progress a muscular strengthening exercise for the quadriceps muscle. So depending on where you're starting, maybe post-ACL rehab, you want to start with isometric contractions and move your way up to isotonic or isokinetic. So today we're going to go ahead and say that our patient is a post-ACL repair, and we're going to start off. Go ahead and scoot back, set your legs on the table. We're going to start with a first exercise for when the quadriceps muscle is either really weak or really compromised, and those are just going to be some basic quad sets. So what you're going to do with that is you're going to have her sitting with her legs straight just like this, and you're just going to have her contract her quad muscle, and I'm going to put my fingers here so I can feel it. So squeeze down, and you're going to have her hold that from 5 to 10 seconds, as long as she can, and relax. And you're going to have her do that for a set of 10, or maybe if she gets really weak, she can do that for just as many as she can until the muscle gets fatigued. And that'll help with muscular strengthening at first, and then you can go ahead and progress that as she gets stronger. Go ahead and have your feet hanging off the end of the table. And we can start with basic leg extensions. So I'm going to once again place my fingers here, make sure she's getting a good quad contraction, and just have her extend her leg up and squeeze when she gets to the end. Hold that for 3 seconds and then slowly come back down. Good. And you can progress this by putting on some ankle weights, or when she gets to the point where she can use the actual leg extension machine in a fitness center or a weight room, then we can start doing stuff like testing her 6-rep max and giving her sets of 3 or 4 with a certain number of weight, and have that progress as she gets stronger in her quadriceps muscle. And that is muscular strengthening. Thank you.